All right, fantastic. Welcome everybody today to a webinar with attorneys we have with us from Underberg and Kessler, who are going to be going over what I imagine are a number of items that are probably on your desk, in your email boxes, in your emails, and that your businesses are dealing with, as we are here at the Chamber as well. And I've had a lot of conversations with members about the New York HERO Act and employer mandates that are impacting your business. And so, as I said, we've brought back the folks from Underberg and Kessler who have been with us for a number of years throughout all of COVID, giving presentations and really just keeping you abreast of the things on and impacting your businesses. So with that, I will turn it over to the folks at Underberg and Kessler, Paul Shoemaker, Alina Nadir, and Ryan Eisenbach, who will introduce themselves and go through their presentation. So the floor is yours.
Thanks very much, Laura. Hope everybody can hear me okay. If you can't, please let us know in the chat and we'll figure out the technology. Thank you for having us. We're always happy to work with the Chamber for many, many years. And we're going to split up the presentation. Myself and Jennifer, Alina, and Ryan will do a little bit of the presentation for you. We are all here in the Rochester office, as you see, but we also have an office there in Geneseo, which is always great to get down to, and as well as offices in Rochester and Buffalo and Canandaigua. So the HERO Act is, hopefully you've all heard of it. If you hadn't heard of it, this is a very good day for you because we're going to tell you what it is and get you set up with it. If you've never heard of it, you've missed a couple of deadlines, but we understand the Department of Labor is not aggressively going after people who've missed it. There's many folks out there who have some other things on their mind, understandably. So when they passed the HERO Act not very long ago, this year, they told us in notes and regulations, formally and informally, that it wasn't about COVID, that it was something for the future airborne infectious diseases. So we're sort of better prepared for the next pandemic, God forbid there is one. Well, that didn't last very long because very shortly after Governor Hochul decided that it was to declare that the HERO Act activated, so all the plans that we were put in place under the law all of a sudden became real and we had to operate under them. So luckily a lot of it is exactly the same type of things that we were doing during COVID that we learned since March of 2020 and put together. It's just a more formalized version of that. So a lot of this will be familiar. A lot of this you all are probably doing already, maybe not all of it, so that'll be good to see. And so we'll go through it for you. So it's as I said, related to airborne infectious diseases in the workplace and community spread, and to protect and try to minimize or prevent those. It also, there's a second part of the HERO Act that Ryan will talk more about that permits these workplace health and safety committees for certain employers. We'll let you know about that. It sounds a little scarier than it actually is, but we'll go through it together, and it's certainly very much part of the act and part of they want us to deal with. You can go to the next slide. Thank you. So it's under the New York labor law. It's added a brand new section. It covers all private employers, no matter what the size you are. Now that the joint employer-employee committee that I mentioned a second ago, that's only for when there are 10 or more employees. And that's something that's going to possibly start, if the employees ask for it, coming up here very shortly in the fall of 2021. It allows for severability if they've overstepped their authority. It would just kick out the term, not render the whole act unenforceable. Haven't seen any of that yet. It has a bunch of effective dates. So the basics of the HERO Act goes through first some definitions that we all need to know. It was done both the Department of Labor as well as the Department of Health. So they did work together on that. Like nearly every law out there that relates to employment law, you can't retaliate against employees who talk about the HERO Act, who want to exercise their rights under it, or want to complain about things even. And very, very important for retaliation on the HERO Act and for most other employment law statutes. Anti-retaliation applies even if the employee is wrong. So if the employee comes to you, oh, you have to scrub the table 25 times a day in the lunchroom in order to meet the HERO Act. We very nicely explain to them that's not what it says, and it's not in our HERO Act plan. And but still, you'd have to be careful thereafter not to retaliate against that person because they made a incorrect complaint. Now, sometimes there's exceptions. If somebody is intentionally lying about in a complaint, then maybe it wouldn't apply. But generally, be careful not to retaliate against anyone who complains about any employment law provision, really. I think we got a little typo in retaliation there, but that's what it is. So there's some timeframes in here. There's some posting requirements, as I'm sure you've seen with a lot of the employment laws. When policies are changed or passed, you need to post it. This is one of them, this HERO Act. Your HERO Act provision should be posted. And a little bit about the anti-retaliation section. So in terms of definitions, employee is very, very broad, which is common these days. So, you know, sometimes we get calls to the part-time workers count, to the per diem workers count, you know, generally they are, just assume that they are. And particularly for purposes of the 10 employees who need to have the safety committees available if the employees request. And employers, regardless of, like I said, any employer, regardless of industry or how the employer is set up. Workspace, workspace is another definition that's very broad under the HERO Act. Could be somebody's car, could be their home, their house, any sort of other place where they do work. Infectious disease is pretty self-explanatory, again, broadly defined. And supervisor is important in the HERO Act definition related to the safety committees, which we'll get to in a few minutes. So we give you this employee definition just so you can see it in case, you know, in your particular workplace you have independent contractors now. So of course, an independent contractor is not an employee. That's the definition of what it is, but except in the New York labor law, where they've decided to throw English out and make independent contractors part of the definition of an employee. They're really not an employee, but for purposes of this law, they are. And what all it means is they're going to count everybody who has anything to do with your business. So independent contractors, day laborers, temporaries, seasonals, just be aware it's quite broad. And it's not going to matter if they come to you from a staffing agency. It's all part of the HERO Act. You guys can read the long paragraph, but just keep that in mind as if you're close to 10 and wondering about these committees, especially. Like we said, employer is also pretty broad, regardless of how you're set up, whether you're an individual or an entity or any of those type of entities and what industry you're in, and even the municipality, the arms of the state or political subdivisions of the state, public authorities, they're not included in this, as they often are excluded from employment laws. Whether that's fair or not, that's for you to decide, but that happens a lot. The next definition is a work site. And like I said, right in the front there, they have vehicle, just to emphasize that it's a very broad definition, and you be careful not to just say, oh, you know, driving in your car while working doesn't matter, you know, your house doesn't matter. You know, for example, you may know or not know if you have people who work at home and they, you know, trip while walking, you know, from the printer to their phone, that's probably a workers' comp claim if they're working, which you wouldn't have figured because they're at their house, but that's again, a broad definition of work site under the HERO Act. So one of the things that the Departments of Labor and Health did do is when it was passed, they put out model HERO Act plans, which was very helpful as getting us templates to work off of. And they did them for quite a few industries. There were of course a bunch that they missed, so of course we got called about that. I have this type of industry, it doesn't fit any of your 11 boxes, what do I do? So we, basically tried to pick the closest one because it's a lot easier to use the template, no doubt. Now, you could have, or if you haven't done it yet, you could now develop your own plan instead of using one of these 11 templates. I highly recommend not doing it. It's a ton of work, and the baseline is you have to meet, if you see on the bottom there, you have to meet or exceed the standards in the templates. And if you're making up your own, arguably it would be all the templates or whatever is the most strict of those 11, which I don't even know. So the best practice is to pick one of those that fits your workplace and use that as a template. And then there's some choices within the templates, but that's the way to go. And one of the things, we've had a lot of calls on this, where people did take the template, they filled it out, put it into place, then when the governor declared the COVID is activating the HERO Act, they activated the HERO Act, and then all of a sudden they read it and realized all these things that they had to do. So make sure you read it when you set it up, or if you have already set it up, please go back and read it, because there's quite a lot of things in there, some of which were optional to include, but if they're included now and your HERO Act is activated, you need to follow it. And but like I said, as scary as that sounds, the Departments of Labor and Health are not running around doing audits of companies on their own. What they might do, and why we're careful, is if an employee calls them and complains, they might look into it. So obviously you have to comply, but it's not an audit situation right now where they're running around looking for excuses to fine people. But if they get a complaint, we're certainly we'd be concerned, and we want to help you out with that complete response and negotiate with the departments if God forbid there's something. So what kind of requirements are in the HERO Act? There's a lot of them, but the good news is you've done a lot of these by either law or practice since March of 2020 when this all started. So employee health screenings, a lot of people stopped doing those when things opened up again. So they're in a lot of the, if not all of the templates. We're certainly doing them again, so we just do an email to everybody every day saying how you feeling, and if you're not feeling well, go home or get a test, whatever. So that's part of it. Face coverings are part of it. We're certainly doing that. It's as you may know, the CDC is recommending that even vaccinated people in the public areas of the workplace wear them when they're sort of walking around or gathering. So that's part of it. The PPE, which hopefully folks have been doing all along and continue to do, encouraging folks to wash their hands and providing stations for that. The shared equipment and the touch surfaces. This is a tough one. We've all read the same news articles that COVID largely has not been shared through equipment and tables and desks and pens, but it's still in there. I think it's more of a better safe than sorry idea for them, but it's in there. Effective social distancing as much as possible, and certainly when it is accomplished, allowing people to take off their masks when they're 6 feet apart or have a barrier between them. Compliance with the orders of isolation and quarantine, obviously that's a very important one. The New York State Department of Health and the local county departments are still doing them. They're not perfect. They're not perfectly consistent. We've had periods of time where the letters haven't come when people have been sick and notified the department, but hopefully those are happening more often. Applicable engineering controls, that's your air through your building. We're lucky here in our place that it's very, very good. But there's sections in the HERO Act about that. A designation of someone or some ones to enforce the plan and take complaints if there are any. Very important that your employees know who they can talk to if they have a problem. Compliance with all notification laws, rules, et cetera, outside of the HERO Act, and the HERO Act actually mentions that. And then a verbal review. This is an unusual law in a sense, is that it actually requires, hopefully many of you have done it, hopefully all of you have done it. If not, you can do it now. You actually have to verbally go through the HERO Act with your employees in some fashion. You could do a webinar like this, you could do an in-person meeting, but it actually has to be a verbal conveyance to the employees of your HERO Act and your policies and their rights related to that. Bit of a hassle, but everybody's done it, and you should. That's something that, you know, God forbid we had a mini breakout in one of your places and you hadn't done this. That's not optimal. So, and we'll talk a little bit more about that, but make sure you set up that meeting if you haven't done that already. So I'm going to turn it over to Ryan to cover the next section of the requirements of the Act.
Thank you, Paul. And as Paul was saying, the purpose of the HERO Act is essentially just to put in writing for each workplace what hopefully everyone has been doing for the past year and a half or so. Slide's a little out of order, but so in a minute we're gonna look at what the actual table of contents of each HERO plan actually are. And if you haven't already seen them, each model plan is available online at the Department of Labor website. You can download them, they're filled with PDFs. It's incredibly easy to just get this done. This slide, we'll get to the bottom two bullet points in a minute, but the most important thing for the HERO plan is employers must create and implement a plan that either meets or exceeds the HERO Act requirements. So with this, the only thing that's currently exceeding the HERO Act requirements that I know of are the OSHA ETS that, I mean, really, the healthcare industry is putting up with, burdened by, whatever you want to phrase it. Employer responsibilities primarily are to create and adopt a plan and put it into effect, which should have happened about a month and a half ago now. Can we go to the next slide, please? All right, so as I was saying, if you looked at one of the model plans put out, this is what you would find as far as the structure of each one. What we just went over, just kind of a brief, what your responsibilities are. The main components of the HERO Act are the second bullet point, which is really what Paul was saying, that like everything that's going to be in writing that you're gonna have to stick to is really in number 2. I mean, they're contained throughout, but the important stuff that the employer actually kind of has some discretion over is in Roman numeral 2. So, as Paul was saying, when you're filling out the HERO Act paperwork, if you haven't already done so, just don't check the boxes and fill everything out, because technically you will be held accountable, or you will have to follow through with what each plan says. It's not too late to amend them, but as we'll talk about in a minute, if you amend the plan, you're gonna have to verbally convey it to your employees once again. Sorry. Yeah, as I said, we'll go through each of these in turn, but these should be essentially what we're doing anyways. And as Paul I won't go through each one of these again. These are just the general, because we're dealing with coronavirus right now everywhere, should be adopted in the workplace. As you'll see, face coverings and physical distancing are highlighted to some extent. We'll get to those in a second. But generally, these are just basic common sense. Doesn't even have to be related to coronavirus. If somebody has the flu in the office, has a cold, these are just fairly standard protocols that are not just in writing with the HERO Act. All right, so as I said, by and large, the HERO Acts have not changed since the DOL put them out a couple of months ago. On September 23rd, the model plans were updated slightly, and that was just to keep them current with CDC recommendations. So as far as masking goes, the model plans now generally put forth that if your entire workplace is fully vaccinated, masks are not necessary. The second is just kind of fine-tuning the definition of physical distancing, which it just adopts the CDC standard, which is still the general 6 feet away from each other, which we're not practicing this afternoon. This aspect of the HERO plan is a bit more, it's not as straightforward. I don't think the advanced controls, I think a lot of people are confused with what they have to do or what they're required to do through the HERO Act. You're not required to do anything under the advanced controls, but if you put it in writing that you're gonna install a ventilation system in the office or put up plastic barriers between workspaces, you have to do those things. But that's what the advanced controls are kind of, it's the next step beyond washing your hands or staying away from each other. Don't come into the office when you're sick. And it's really just to have these plans in place so we're not all scrambling like everyone was scrambling in March and April. What are we gonna do with everyone? We can't come to the office. This is, the mandatory orders of quarantine. So the first is to have a plan in place if there's an outbreak again, as we currently are we gonna eliminate people? Are we gonna furlough individuals? As I said, are we gonna re-engineer the building or our work offices? Ventilation, are we gonna install fans? Is it enough just to crack a window? The administrative controls, to stagger work hours, to send people home to work remotely. There's a lot of variations that employers can adopt, just, what works for them. So like I said, don't just go through the model plans and circle blindly whatever it is. Give some thought into it because again, you will be held to these things. And the last one is the PPE. Just have a plan in place, just know where it's stored. And that's really what C touched upon. The plan needs to have where things are located, what we're gonna do to maintain those things, and so forth. Housekeeping is also very basic. The Department of Labor puts everyone in connection with proper cleaning standards. I really hope that everyone already knows how to clean tables and stuff off, but if they don't, a couple websites provided with approved disinfectants. Roman numeral 4 at the bottom. Infection response during the designated outbreak, that's simply what are we going to do if somebody comes in sick? If we have a guest or a customer who comes into the workplace sick, essentially how are we going to report that to everybody? Are we going to send individuals home? Again, this is just putting a plan in place so it's not stumbling through on a case-by-case basis when it happens. It's just everything's going to be in writing. We're going to know what to do when it comes up. This is very important. As Paul was saying, training and providing your employees with the information concerning the HERO Act has to be conveyed verbally. There's no set form it has to take, as Paul was saying, but it just needs to be done kind of more person to person rather than just blindly throwing an amendment to your handbook at employees. But to that end, if you do have a handbook, you need to include the HERO Act in it. I suppose the easiest way to do this is just once you have adopted a HERO Act plan, just staple it to the back of your handbooks. When you do verbally convey it to your employees, just hand it out and tell them to amend it themselves. If you do update your handbook, just include it in that. And I mean, you can email it to your employees. There's no right or wrong way to do it, but it just needs to get done. And as Paul was saying, like a lot of the other posting requirements for minimum wage and so forth, this also has to be posted in the office someplace that the employees know about. And to continue on with that, so the way that the law is structured, employers are supposed to provide employees in either English or their primary language a copy of the plan. As of right now, or there's a caveat to that, employers only need to provide an alternative language of the plan if it is offered by the DOL. Currently, the DOL only offers it in English and Spanish. If you have an employee that doesn't speak one of those two languages, an English version is sufficient. And there are certain criteria to when you have to convey this. So you see 30 days after the plan is adopted, which hopefully should have already happened. If we go through another mandatory quarantine, you're gonna have to reconvey all of this verbally to employees within 15 days if your office is reopening. And of course, if somebody new starts, it should just be incorporated into their new hire paperwork. And again, that can be done through a handbook just very easily. As I said, plan evaluations during an outbreak. Paul was saying that this was not intended for COVID-19, but it just kind of turned out that way. So just theoretically, if there was an infectious green cloud of something going down the street and it was the biggest worry in the world, you would probably need to amend your HERO Act plans to incorporate whatever that concern is down the line, wherever it may be. The HERO Act is just kind of the floor for what is expected of us all now in case this kind of thing happens again. The plan evaluations during outbreak, just keep in mind that you have a responsibility to keep abreast of current developments and pivot as necessary. Also, very, very important, the way that the law is structured, it provides for both an anti-retaliation provision in and of itself within the law, and it requires each model plan to include the anti-retaliation provision so employees know about it in advance. And this is pretty basic. It's you can't retaliate against somebody for exercising their rights, for wanting the plan to be enforced, for having concerns about their own safety in the workplace. It's fairly basic, and we'll get into it in a second. There is a little wiggle room with that, but just know you can't retaliate against anybody for expressing their concerns about what's going on with the HERO Act or COVID in general for the most part. Alright, without knowing how many of you are bound by collective bargaining agreements, I'm assuming that if any of you are, this has already been taken care of, but if it's not, you can't just implement a HERO plan without consulting in some manner with the bargaining representative, the shop steward, whoever it may be. You have to consult the union before putting anything into place, which the union, I would assume, would spearhead most of that. Okay, workplace safety committees. Employers with 10 or more employees. As Paul was saying, employees is very broad. So it's very easy to add up to 10. So only one committee per worksite is required. And this applies to if you have multiple locations. The Act permits you, but does not require you to set up a workplace safety committee. Those. Really, the only caveat to this, other than allowing for your employees to form one of these, is the composition of them. So it needs to be 2/3 non-supervisory employees, with the supervisor being the other third. And as we'll discuss in a second, concerning supervisory employees, or we already went through the definition, but essentially there's going to be no loopholes to who's a supervisor. Just because somebody has management in their position doesn't necessarily make them a manager. Just keep that in mind. So as you may imagine, the workplace safety committees would have certain functions, really just to make sure the model plan is put in place, it's being followed. They're allowed to any complaint of violations of the plan or workplace safety in general can be brought to their attention. Importantly, employers are required to compensate the people on these committees for their time. It's not much, I believe in total it's about 12 hours per year that they're allowed to either attend trainings or meet with the committees themselves to kind of go over things. So it's no longer than 2 hours quarterly, I think is the max for the meetings themselves. So it's not burdensome, it's just you can't retaliate against people for exercising these rights. They have to be allowed to do any of these things. But in all reality, it should not take a whole lot of time. I guess what everyone wants to know about. Can I get in trouble for not doing any of this? So, yes. For anybody familiar with the New York labor law in general, the way that the penalties for this are structured are kind of in keeping with that. So it's $50 per day to a max of $10,000 for each violation. So as Paul was also saying, we don't know of anybody being busted for this yet, but it's not out of line for that to happen. Again, nobody expected the HERO Act to be implemented for coronavirus, and as aggressive as things are getting with vaccinations and so forth, it's not out of the realm of possibilities the Department of Labor would start checking for these things. So, as we're also saying, one of your employees can, under the HERO Act, bring a claim against you for violating that creates a substantial probability that death or serious physical harm could result to the employee from a condition that exists in the workplace. This sounds much worse than it actually probably is going to be in reality. So, as you can see from the middle bullet point, frivolous claims, employees are going to be required to pay attorney's fees for anything that really is kind of a bogus thing that's brought up for any of these. If you go to the next slide, Lindsay. Thank you. And as I said, it sounds worse than it is. So employers have a cure period. So employees, before being allowed to bring a civil suit, need to give their employers notice of whatever the violation is claimed to be, and the employer has time to fix it. So theoretically, if you catch this stuff in advance, there really should be no litigation that results from, hopefully, non-compliance with any of this stuff. And these are the important dates, but hopefully you all met. So as you're saying, July 5th, the templates were released, which triggered the dates for employers to put them all into effect. August 5th came and went for everyone to adopt their plans. September 4th also is gone. The deadline to communicate with employees. Coming up though is the deadline to form the workplace committees, November 1st. These deadlines, or at least the November 1st deadline, is still going to be applicable if you have not done the HERO Act. So if you do it today, your employees will still form a workplace safety committee by November 1st. And the next slide is the remainder of the important dates with respect to the HERO Act. So I'm sure you're all aware, that's why you're watching us, that on September 6th, the governor declared COVID a highly infectious disease. October 5th, that designation was continued. So currently, we're finishing up the month with a highly contagious infectious disease designation. I suspect personally that it will continue. but really there's no indication. It was supposed to come out September 31st, and as you can see, it waited until October 5th or the state waited until October 5th to renew it. But in all likelihood, this is going to continue until, COVID is not in the rearview mirror, so to speak. Now I will turn it over to Alina.
Okay. So we're going to switch gears a little bit from the HERO Act to what has been in the news a lot lately is the vaccine mandates. We know they're coming down. Some companies have already put them in place. Some federal government ones are coming soon, probably. And I know some employers are considering them. And there are some implications with putting a vaccine mandate in place. Just some things to be looking out for if you are implementing this, as you are dealing with some of the questions you might be getting from employees. So there are anti-discrimination laws in place, as we all know, have been in place for years and years. There could be implications when if you are considering requiring all your employees to receive the vaccination. So just a quick overview of this area that the Equal Employment Opportunity Commission last updated its guidance on this on October 13th. They are responsible for enforcing federal anti-discrimination laws. New York is largely following the CDC guidance at this point, so that's kind of where we're looking for information there. Remember that this is rapidly changing. The COVID-19 situation and research and guidance has been evolving throughout the past year and a half, as we all know. So it's important to keep abreast of the changes and make sure that you're changing with them. So we'll be tracking the changes as they come. Important to keep your policies updated to make sure that you're not saying anything in there that could run afoul of some of these concerns that we'll go into. Treat all cases as a case-by-case basis. When people are asking for exceptions or they're objecting to this, to the mandates, and in all aspects of employment law, we tell people on everything, document your conversations with employees on asking for exceptions, about talking to them about it, and make sure that you're keeping that documentation somewhere you can access it. Importantly, vaccination status is not a protected class for private employers. That's not a discrimination category. I know some people will say, they're being discriminated against because they're not vaccinated. That is not a thing under federal or state law. That's just not a real category at this point. We are only required as employers to make accommodations as far as a vaccine mandate for those who cannot be vaccinated for legitimate health or religious concerns. It has to be legitimate, something not just, they don't believe in the science generally and they just don't want it. That's not a valid request for an exemption from a vaccine mandate.
My chiropractor said.
Your chiropractor said, right? Your chiropractor is probably not going to be the one that's going to give you a valid health concern that would prevent you from getting vaccinated. Just a little basic background on the constitutional basis of mandatory vaccination. There's a lot of, again, we've all seen social media posts, we've all seen things in the news that it's not constitutional or it violates individual liberties. That's just not really what the case law of the United States has to say about it. So this is a long-standing issue in the US. The first state law that mandated vaccination was in Massachusetts in 1809. This is not a new concept. So it was approved all the way back then in 1855, Massachusetts, also the first state that enacted school vaccination requirements. And the states have this power to enact these mandates because they are entrusted with essentially what's called police power of the state. They have the power to act in a way that will protect the public health and safety of their citizens. And the case, one of the cases was it was called Jacobson versus Massachusetts. And there's a quote there. And again, in that case, they found, I won't read the quote for you, but they found, again, that the greater good can sometimes outweigh those individual liberties. And here, where, your individual liberty to not be vaccinated may mean that you carry a bigger viral load and then spread it to your coworkers, is outweighed by the public good to protect those people around you. So federal workplace discrimination laws that are implicated or potentially implicated in these vaccine mandates is there's a whole list here. We have Title VII of the Civil Rights Act, which is kind of are one of the catch-alls under federal law that protects race, gender, religion, etc. The Pregnancy Discrimination Act, the Age Discrimination in Employment Act, the Americans with Disabilities Act, and the Genetic Information Non-Discrimination Act of 2008. And under New York State, there's again a few laws implicated. The New York State Human Rights Law, which again is kind of the catch-all in New York State that covers a lot of the protected categories as far as anti-discrimination policies. New York City Human Rights Law has its own human rights law. So if you do have locations there, it's important to know that there are, the state one does kind of mirror New York City these days. It used to be a little less strict. It's pretty similar now, but you need to make sure if you do have New York City locations that you're complying with that as well. New York Forward, which was the guidance related to reopening offices after COVID-19 had the shutdown, is another thing we've got to look at. But as of May, we've been following the CDC guidance rather than New York coming up with its own policies. There are New York executive orders and New York Department of Health guidance to take a look at. There is currently a bill pending in the New York State Assembly, which is very unlikely to pass. In addition to the things listed there that it relates to prohibiting mandatory COVID-19 vaccination and acts of vaccine bill of rights, it also limits civil liability for employers and issues related to vaccination. Prohibits, again, the mandatory vaccines for education, employment, and travel. It's very unlikely that's going to pass, especially in New York State. So a group of lawmakers are trying, but I doubt it's going to go anywhere. But legally, New York State often follows the standards and guidance of the federal laws here. So under Rule Title VII in the ADA, employers are required to provide reasonable accommodations for those that need it. And so this should be a familiar concept to most of us. Most of us have been through this in some way at some point. So for employees who have a disability or a sincerely held religious belief, practice, or observance, if they can't get vaccinated for some reason for COVID-19, we might be required to make a reasonable accommodation for those people. And the accommodations must be made unless it would pose an undue hardship on the operation of the employer's business. In most cases here, that's probably not going to come into play unless there's something really unique about the workplace that would prevent us from accommodating a non-vaccinated individual. Just some suggestions for accommodations for those who are unvaccinated and coming into the workplace. We could do, have face mask wearing for them or for everybody around them to protect everybody. Keep them at a distance from coworkers or people entering the office, other non-employees. Work a modified shift to lessen their exposure to others. Require periodic and or regular testing for COVID-19. Maybe they want to work from home. That could be a potential opportunity there. Reassignment, if it makes sense. For people who are pregnant, who are not vaccinated because they've chosen not to because of their pregnancy, we have to go through the same factors as far as making an accommodation and make sure that if those adjustments would be made for someone who's not pregnant, they'd also be made for someone who is. Remember, as always, to engage in the interactive process when you're going through this. If someone says, listen, I have XYZ religious beliefs, they're sincere, I can't get vaccinated because of it, you gotta make sure that you can't just say, well, we're gonna reassign you to an entirely different shift, a different department, and that's just is what it is. They might say that's retaliation for them asserting their religious beliefs and making sure, letting you know about that. So engage in that interactive process with them, talk to them about what makes sense for both the employer and the employee. Document that conversation so that everyone has a record of what's going on, and that should they have a claim later on, you do have documentation that you were working with them to do what you can to accommodate the issue. There may be issues. This is things that we don't know what's going to happen yet, because this is a fairly new area. Mandates are coming down, the road. In some cases, you may need to respond to allegations that the requirement has a disparate impact on certain populations, a certain religion, a certain race, etc. So just keep that in mind, and that might be related to the fact that you put a vaccine mandate in place and say you can't come to work without it, and some people might have greater barriers to obtaining those vaccinations for whatever reason. And it therefore excludes them from the workplace. And if it, falls within a certain category of people that all share a certain category, you could be looking at a disparate impact claim. And that can be the case whether or not you intended it or not. Even if you didn't intend it, the fact that it occurs in that way could be the basis of a discrimination. So it's important to keep it on as well. So under the ADA, which enforces anti-disability discrimination laws, an employer has to maintain the confidentiality of the employee's medical information, such as here, documentation or confirmation that they've been vaccinated. Because of course, under the ADA, often someone will need an accommodation, and the employer has the right in that case to ask for medical documentation, but as always needs to maintain that confidentiality. And the confidentiality requirement applies regardless of where they get the vaccination. So that's important as well. And while the equal employment laws don't prevent you from asking as an employer to bring in that documentation and to confirm the documentation that they have been vaccinated, or that they can't for some reason due to disability, that must become confidential, and you shouldn't keep that in your regular personnel file, or any HR individual could be looking through it. It should really be kept in a more confidential place under hopefully lock and key. In the federal the vaccination cards that we got when we got vaccinated, they're supposed to be for personal use. They are a tool for employers to verify that there is vaccination, that the employer has been vaccinated, and they found that there's no discriminatory motive in asking for those cards or some kind of documentation. You can ask for documentation showing when the vaccines were administered. And it's not a disability-related inquiry under the ADA, under the guidance that has come out to for proof of vaccination. But you shouldn't ask any further. I mean, did you get vaccinated? Yes. Okay, here's the proof. Or if they have a disability that prevents them from getting vaccinated, just get to the bare minimum of what you need to confirm that and move on. Don't, ask them to divulge further information. So if you have an employee that says, I can't get vaccinated, we have a mandate in place, but I can't get vaccinated because I have a sincerely held religious belief, practice, or observance. Once they say that, we should try to provide an accommodation for that. Unless it is an undue hardship for some reason, we should, just to be on the safe side, assume that the request is based on a sincerely held belief, practice, or observance. Try to avoid interrogating the person, unless, of course, it seems completely bogus and you have an objective basis for believing that. Just makes absolutely no sense, or they say I'm this religion and the person in that head of that religion says that's absolutely not the case. Maybe then that's an objective basis, but for the most part, just go with what they say, unless for some reason you have a real reason to doubt it, and accommodate that as far as much as you can. And consider all possible reasonable accommodations, telework, reassignment, if that's what they're asking for. But again, don't just assign without going through that interactive process with them, making sure that they're okay with it. If an employee chooses not to get a vaccination because they're pregnant, they can seek job adjustments, just like people with disabilities, with religious issues with the vaccination. Just ensure that the person is not being discriminated against as compared to other employees that have a similar ability or inability to work. They may be entitled to job modifications, working from home, changing the work schedules or assignments, or leave to the extent it makes sense, and that it would be provided for another employee with the same issue or similar issue. So can we require COVID-19 vaccinations for all employees, even though we know that some might not be able to get it because they have a disability? And the answer is yes. You can still put that vaccine mandate in place, and just make exceptions for those with a disability that can't get the vaccine. You can, in general, too, require someone with a disability to get the vaccine. However, if the vaccine or if the standard that's being put in place is job-related and consistent with the business necessity, we can only require it unless the fact that they're not vaccinated poses a direct threat to the health and safety of that employee or other people in the workplace. So a direct threat under the law is a significant risk of substantial harm that can't be eliminated or reduced by reasonable accommodation. So maybe that person can't get vaccinated, that's not a direct threat if they can work from home, if we can put them in a separate area, put up physical barriers, et cetera. There has to be something going on that means there's a direct threat to themselves or others around them that would meet that direct threat requirement. So in order to figure out if there's that direct threat or risk of substantial harm, you have to look at the duration of the risk, the nature and severity of the potential harm, the likelihood that the potential harm will occur, and the imminence of the potential harm. So basically, a lot of words to say, look at how bad the situation is, weigh those factors and see if this is a situation where having someone with a disability and an unvaccinated person would be a serious threat in the workplace. That determination of a direct threat should be based on reasonable medical judgment, relying on the current medical knowledge about COVID-19. And it should take into account the type of work environment that you're dealing with. I'm going to hand it over to Jennifer.
Okay, I noticed that we're getting close to the time, so I'll try to speed through, but then feel free to stay afterwards and ask questions through the chat or live afterwards. So the question here is, can an employer administer the vaccine? So you might have, like for example, we have a flu clinic here every year where we bring in an outside party to come in and we offer it to our employees. It's completely voluntary. That is completely allowed for the COVID vaccine, but we have to keep in mind that there could be potential ADA obligations triggered from providing the vaccine at the work site. So first of all, the CDC requires, or recommends rather, that certain questions get asked before the vaccine is administered. And that would necessarily lead to an employer who's administering the vaccine having protected health information of their employees. So we want to be careful, if we're screening and making those screening questions, that they are likely to elicit information about a disability, and so that may trigger some additional responsibilities on the employer's part. The disability-related screening inquiries must be job-related and consistent with business necessity in order to be compliant with the ADA. We are not required to satisfy the job-related and consistent with business necessity requirement under two circumstances. One is that the vaccine is completely voluntary, it is not required, we are not mandating it. And two, if there is no contract between the third-party vaccination provider and the employer. So if we just bring in, a healthcare agency to administer these vaccines, and we have no relationship with them other than the fact that they're providing the vaccines, then that would be considered an exception. Remember, under the ADA, employers are required to keep any medical information separate and confidential if it's obtained in the course of a vaccination program. So GINA, that is the Genetic Information Non-Discrimination Act of 2008. It is essentially a discrimination law that prevents employers from discriminating against individuals based on their genetic information. So it also restricts employers from requesting, requiring, purchasing, or disclosing employees' genetic information. It is not implicated, though, if an employer requires an employee to show confirmation of a vaccination. So requiring that vaccination card or some kind of proof of a vaccination does not implicate GINA. And even if the medical questions that are being asked include questions about genetic information, it still would not, be a violation, because getting the card, the vaccination card, would not reveal that genetic information or the answers to those questions. Ryan talked earlier about the National Labor Relations Act as it relates to vaccine mandates. I don't know, again, how many of you, if any, are union employers, but we have to keep in mind that this is a mandatory subject of bargaining. So it's not optional, it's not permissible, you have to bargain over it. And that means that, we have to have, reasonable amount of sessions. If we can't come to an agreement, we go to impasse, all of those things. And mandating a vaccine is a term and condition of employment. So we can't just say, oh, it's management rights, we're gonna, impose a vaccine requirement on the workplace. That is not permissible. We have to bargain before we mandate it. Now, it doesn't mean we can't implement it if we can't agree, but certainly we have to go through the exercise of bargaining over mandatory vaccinations. Also remember, when we're still on the subject of unions, that the law requires that individuals are allowed to talk about their terms and conditions of employment, including complaining about their terms and conditions of employment. So we have to keep in mind that we cannot treat them differently or discriminate based on the fact that they're complaining or talking about having a mandatory vaccine, for example. Additional considerations, exclusively recruiting individuals who have been vaccinated. So for example, if you put in an advertisement that, must be vaccinated in order to work here, that could present disparate impact claims. So you're gonna wanna make sure that your job postings and advertisements do not have any language in there that would lead anybody to believe that you're only considering individuals who are vaccinated, because again, the ADA and Title VII would require that we make a reasonable accommodation for individuals who cannot be vaccinated based on either a medical condition or a sincerely held religious belief, and that includes hiring. So we have to make sure that we treat everybody fairly all the way through, from hiring all the way through employment. The Fair Labor Standards Act also could be implicated. If we require vaccination, then we have to pay the employees to go get vaccinated. So it could, lead to overtime perhaps. We just want to make sure that we're paying them for a time that they're out of the office getting the vaccination. And then we can go through, I'll skip this slide. This is a recap of what we've already gone through, but really quickly look at the New York vaccine mandate. And on August 16th, Governor Cuomo announced that there would be a vaccine mandate for all healthcare workers. I'm sure everybody has heard about this again and again. On August 18th, the Commissioner of Health issued a mandate for all covered personnel and required that they be vaccinated by September 27th, 2021, which just passed with a lot of fanfare. Limited exceptions for religious or medical. Then on August 26th, they removed the religious exemption, and guess why? Because employers were becoming inundated with religious exemption paperwork. All of a sudden, everybody had these sincerely held religious beliefs that they could not be vaccinated. So the New York State decided to take that requirement out. And as you'll see a little bit later, of course, people sued, and that requirement is now back in. So the covered entity applies to general hospital or nursing home, and we're not going to go into what those mean. And covered personnel is essentially anybody who comes into contact with the public. So that would include patients, residents, personnel, etc. So really the only people that this would not apply to may be a cleaning person who cleans an office that's empty at night. Other than that, all employees are covered. On September 14th, Judge Hurd granted a temporary restraining order for those religious exemptions. And on October 12th, there's a preliminary injunction. So right now, you can have a religious exemption if you work for the healthcare industry and you don't want to be vaccinated. That order has been appealed by Governor Hochul, so we will see where that leads. But for right now, if you're in the healthcare field and somebody brings you some kind of documentation of a sincerely held religious belief, it's always best to err on the side of caution and grant them the accommodation. As of September 27th, all covered personnel must have received their first dose, and that date has passed. So, There's also the federal vaccine mandate, and I'm gonna run quickly through this because I see that we are 5 minutes over, but on September 9th, President Biden announced a number of proposals related to combating COVID-19. And part of that was mandatory vaccination for federal government employees, including contractors working with the federal government, staff at healthcare facilities receiving Medicare and Medicaid funding, and all private employers with 100 or more employees. So this covers an enormous amount of the American workforce, about 2/3 of all the workers. There also previously had been a federal vaccine mandate for federal contractors. Those individuals must be fully vaccinated no later than December 8th, 2021. This is separate from the legislation, or the rule rather, that President Biden announced in September. And so beginning in October, any contract solicitations between October 15th and November 14th have to include a clause that states that that all employees must be fully vaccinated by the first day of the period of performance. And all contracts awarded after November 14th must have that clause language incorporated in the contract. Anything predating that will have to incorporate the clause if and when an option is exercised or an extension is made. There's a lot of information here, so if you are a federal contractor, you're gonna wanna reach out to us so that we can go through this more specifically. But it is something that is coming down the pike and it is required. Medicare and Medicaid facilities, which is most healthcare facilities, receive funding from Medicare and Medicaid. According to the Centers for Medicare and Medicaid Services, which is CMS, there's going to be a final rule in October. We're getting near the end of October, so it should come anytime now. And CMS had previously indicated that the interim final rule detailing directives for nursing homes would be published in September. So we're still waiting to see whether the nursing home interim final rule will continue on the September, well, it's gonna be actually definitely delayed at this point to October. So sorry I rushed through that. I know that's a lot of information. If there's any questions, we will take them.
Can you guys hear me?
Yeah.
Okay, there was a question in the chat from Lisa. It said, how are the 10 calculated? Is it 10 or more employees on a payroll period or 10 people under a fiscal year? They have only 3 to 4 employees. Do you see the question there? But a few times a year, they hire more. And you guys are muted right now, so go ahead.
Wait, hold on. You were just cutting out, so I'm just gonna put myself on mute. Hold on 1 second.
So if you are able to look in the chat section under general chat, the question was from Lisa Woodhams, and she asked, how are the 10 calculated? Is it 10 or more employees on a payroll period or 10 people employed within a calendar or fiscal year? They only have 3 to 4 employees, but a few times a year, they hire more to handle a special event, but they are only on the books for a few days.
Can they hear me now?
Yeah.
All right, so I believe that those additional, even though they're only working for a day, would count towards those 10 employees. I know it's rough, but I mean, the whole point of this is to include as many people and businesses as possible. I don't know whether the language is phrased annually, fiscal year or not, but if you can see the slide right here, if you want to email me, I don't have a problem just checking quick and getting back to you on that, but I believe it is those 10 employees, those extra people would count towards your 10, and it would be counted for the fiscal year, I'm fairly certain.
Thank you. So Lisa, if you'd like to, you can shoot an email over if you need more clarification on that. We are going to close out of the presentation mode, and if anyone has some questions, they can just ask right on the floor. The speakers will be on the floor for a little bit. Does that sound good? All right. Thank you very much.
Thank you.
Thank you.
I don't know how much the pantomime